Hey guys, if you haven't noticed, we have been talking a lot about our new Softwave machine. This is an incredible device and we are extremely excited to be talking about this with you. It's gonna really change how we're able to help a significant amount of people, okay? So let me just tell you a little bit about this. This is a shockwave technology and it's a Softwave machine. It uses sound waves to penetrate tissue to stimulate regeneration. So yes, this is a regenerative technology. This is not just a simple pain management or something like that. It's actually going to help the body start to heal. So it uses sound wave to penetrate tissue, and that penetration stimulates blood flow. In fact, it increases blood flow by over 300% to that area. It also is really great for reducing inflammation and dramatically reduces pain levels. But the best part is that it stimulates your body's innate stem cells. And stem cells are dormant cells that our bodies have that send to damaged areas to rebuild the tissue. So if there's acute injuries, like if you have an initial strain or tear or even a broken bone, the Softwave is going to actually help to bring blood flow in and to stimulate stem cell regeneration, so we can actually help to rebuild that damaged part of the body. But it's also incredibly beneficial for not just acute but chronic problems. In fact, some of the best results that we've seen so far in the office are from patients that have had long-standing chronic issues. In fact, when we first got our machine, we handpicked a few very specific patients that we wanted to test it out on and really see what the benefits are. And one of the ladies who came in, she was in her mid-60s, but she had been having knee pain since she was about 18 or 19, like since high school. Since then, she's had 4 different knee surgeries and ended up actually having a knee replacement, and still her pain scales on a regular day were like 8 or 9 out of 10. It was hard to walk any range of distance. She constantly had to take Tylenol, ibuprofen just for the amount of pain. So she came in asking her obviously what her pain levels were, how long it's been there, case history with the surgeries and knee replacements. But we had her do a squat test, meaning she stood up and she went to do a squat so we could watch what was going on. And she could barely squat. I'm talking like maybe like an inch. She could barely squat, bend down, and her pain was excruciating. So we did initial discovery mapping where we kind of mapped the area, did initial treatment, kind of testing out where the areas of sensitivity and damage in the knee were. But after that first treatment, we want to see how is the body responding. We need to see functional difference to make sure that this person would be a candidate for treatment. So she stood up, she said, hey, right away she said she had way less pain in her knee. In fact, she said it was like a 10, like a 3 out of 10 versus a 9 out of 10. So there's a dramatic change just in her pain scale. But the best part was when she went to do her squat test, she dang near did an entire full squat with very little pain. It was crazy to see how well her body was responding to this, just even this initial treatment. So she was accepted as a patient because we obviously knew we were going to see a tremendous amount of change. And over the course of around 8 treatments or so, she had dramatic difference. She is walking without any pain. Her knee is feeling better than it's felt in years. But just to show you as just an example of the potential. So if you have ongoing shoulder issues, elbow issues, I've currently been using it on my wrist from adjusting all these patients for so many years. So my wrist tends to really bother me, and so I've been getting it done on my wrist. If you had bad knees, bad feet, plantar fasciitis, blood flow issues, neuropathy issues, those are the things that I really think will benefit the most from this new Softwave treatment. So if you've been having some extremity issues where you're really looking for maybe see if we can help with, like if you have elbow issues or real bad wrist issues or ongoing knee or feet or ankle issues, or even if we're in the midst of going through some corrective protocols and you're still having some issues with your neck or your back, you know, honestly, doing some regenerative therapy might rebuild some of that joint to get more results with the chiropractic care that you're receiving. So if you have any questions, make sure you ask the staff, ask our team. How do we get set up? Typically, it starts with the first discovery mapping of the area where you schedule initial appointment with Shannon. She'll go through some case history, understanding more about what's going on. go through some orthopedic tests to see functionally what that joint looks like, go through initial treatment where they kind of map the area to see where the tender spots are, where the stress, where the damage is, and then post-treatment, we want to be able to see pain reduction and or functional improvement. Those are the two things that we have to see post-treatment to make sure that you're a candidate for getting recommendations. But after that, we'll be able to say, yes, this is going to be very beneficial. You'll do great. These are expectations we should see. Or if you don't respond, it's just you're not going to be the patient that is going to be accepted into this treatment plan. But that's okay. So if you're interested, talk with the team, get scheduled for your initial discovery mapping so we can see how much we can help benefit with our new Softwave technology.